Hello everyone. Welcome to our presentation on Pacific Islander culture, health, illness and healing tradition nursing 222. Today Elizabeth Boscola, Mahogany Moultrie and I, Raoudha Gaaloul, will be presenting. I'm going to discuss in this slide history of the Efik community. Pacific Islanders come from Polynesia, Micronesia, and Melanesia, each with unique culture, language, value, and spiritual belief. Despite their diversity, they share strong family ties and maintain cultural identity across generations. Historically, they relied on ocean voyaging and fishing for survival. Colonization brought challenges such as loss of island, limited resources, and health disparities. Yet Pacific Islanders have preserved their culture, showing the strength and unity of their community. Hoffa 1994, Diaz 2011. In this slide, I will discuss population perception of health and illness. Pacific Islanders view health holistically, connecting body, mind, and spirit. Family and elders often guide health decisions, and families may gather to pray before choosing treatment, showing shared responsibility. Tradition healing practices, including herbal remedies, massage, kahuna or telasi, and prayers remain important. Illness may be seen as a test of faith, while some may hesitate toward Western healthcare due to historical colonization. Warm communication and family involvement foster trust. Mishra et al. 2019.
Hello, I'm going to be discussing the traditional healing methods of the people of the Pacific Islands. They had holistic beliefs. The focus was on balancing mind, body, and spirit. The treatments were mostly plant-based, but they did also include massage and prayer. Healers were generally called different names depending on the region. It could be Tulusa, Kahuna, or Tonga. They generally were from about 21 to 80. Once you were a healer, you were always a healer, so the learning was lifelong. The older elders taught the younger up-and-coming healers. They also knew of one another and would refer patients to one another depending on a specific healer's expertise. Lomi Lomi is a type of massage. It means to weave love. It's thought of as a moving prayer and restores fluidity and balance by using continuing flowing strokes to nurture the body and soul. Massage is believed to channel and align mana, which means life energy, and it helps the recipient release tension and achieve harmony. Historically, this was a family tradition passed down from generation to generation, but it was also practiced within the community as a way to nurture bonds and foster a sense of collective well-being. Pacific Islands is a very large area geographically, so there's hundreds of plants that they used, and it could vary widely depending on the geographic location specifically that people were living in. So I chose two plants that were very commonly used pretty much throughout in treating in their holistic treatments. So we have the noni noni tree, also known as Morinda citrifolia. It is possibly the most medicinal plant in Polynesia. Every single part of the plant can be used, from the leaves to the fruit, stems to the roots. The leaves can be heated and wrapped around a wound, used as a bandage, or they could be macerated and placed into the wound to prevent infection. The young green fruits are used to treat ulcers and mouth sores. Root and stem bark was used topically for external infection or inflammation. And the traditional healers didn't see much use for the ripe fruit, but it was a common household remedy to mash up the ripe fruit and put it on your wounds as a way to heal it faster. Kava has kind of a mystical background. This was originally reserved for the highest ranking chiefs and elders. They used it for pretty much anything, pain relief, muscle tension relief, stress and anxiety reduction. They also believed it had antifungal and antibacterial properties. Kava was dried in the sun. It was ground up into a powder and then mixed with water and made into a tea. If it was prepared a certain way, it was hallucinogenic. So it was commonly used in spiritual rituals to honor ancestral spirits, but also to celebrate birth, marriage, death, cure the sick, and even to prepare for war. They would even celebrate winning a war with drinking kava. So that sums up my talk on the traditional healing of the Pacific Islands. Thanks.
NSG222. My name is Mahogany Moultrie, and I will be discussing Part D of Pacific Islanders' current health issues. For this section, I will be discussing some of the major healthcare issues currently affecting Pacific Islander communities. These challenges are shaped by a combination of geographic, economic, cultural, and systemic factors. First, Pacific Islanders experience a significant burden of chronic diseases. Research shows they have higher rates of diabetes, hypertension, obesity, and cardiovascular disease. These conditions often develop earlier in life and progress more quickly due to limited access to consistent medical care. Second, mental health concerns are a growing issue. Many Pacific Islanders experience depression, stress, and trauma, but these concerns are often go untreated because of stigma and strong expectations around family-centered coping. As a result, people may delay reaching out for help even when they need support. Another major challenge is healthcare access. Geographic isolation, shortages of trained providers, and limited resources make it difficult for many Pacific Islanders to receive timely and appropriate care. Even when services are available, transportation and cost can still act as barriers. There's also the underutilization of preventive care. Many individuals do not receive screenings or routine checkups, which leads to delayed diagnosis and more advanced disease when they finally seek care. Finally, communication barriers play a significant role. Language differences and the lack of culturally tailored health information can reduce trust and understanding between providers and patients. This affects engagement and treatment outcomes. These combined issues show how health inequalities persist in Pacific Islander communities and why culturally informed care is essential. Next, I'll be discussing this slide, which highlights the social, cultural, economic, and political factors that influence healthcare delivery for Pacific Islander communities. Social cultural. Culturally, Pacific Islanders place a strong emphasis on family, collectivism, and respect for elders. These values can influence decision-making, care-seeking, and how comfortable someone feels asking questions or advocating for themselves in a healthcare setting. Traditional healing practices and spirituality also play an important role. While these practices are meaningful, they can sometimes delay seeking medical treatment if symptoms are initially managed within the family or community. There's also stigma surrounding mental health, which discourages early help seeking and leads to underdiagnoses and undertreatment. Economic. Economically, many Pacific Islander families face lower average income and higher uninsured rates. These factors limit access to preventive care and specialty services. Overcrowded housing and multi-generational living arrangements can increase stress and contribute to disease transmission. Remote island economies often depend on jobs without health benefits, which limits continuity of care and makes it harder to manage chronic illness effectively. Political. Politically underfunded island healthcare systems lead to workforce shortages and long wait times. Immigration status can also affect access to insurance and essential services for those living in the U.S. Finally, the history of colonization and government distrust influences how communities engage with public health services. This can affect vaccination rates, screenings, and overall participation in care. Together, these factors shape health outcomes and highlight the need for culturally responsive care and improved access to services. Lastly, this slide represents all of our references. If you want to know further background information on Pacific Islanders, I highly recommend you take a look at some of these references. And again, thank you for listening. Congratulations. We made it to the end of the semester. Have a happy new year and take care.